Good afternoon, everyone. Thank you for joining us for Colorful Cooking at Home this February. My name is Carrie Lindberg. I'm the coordinator of Culinary Medicine here at Gibbs Cancer Center at Pelham in Greer, South Carolina, in the teaching kitchen. It is American Heart Month. We're at the very tail end of it, but we are so glad to have community outreach nurse Greta Beach here from the Heart Failure Clinic to cook up a one pan full of color, full of nutrition recipe for us this afternoon. So, Greta, first and foremost, thank you for joining us in the
Thank
teaching
you for
kitchen.
having me.
Yes, absolutely. What are we cooking today?
So today we're going to make a one pan sheet pan dinner, and we're going to have salmon, asparagus, potatoes. This is actually one of my favorite types of meals to cook at home because it's so easy. You
Mm-hmm.
prepare your ingredients, you can kind of stagger things on your pan based on cooking time, but in the end, you really dirty a lot less dishes
Mm-hmm.
and it simplifies things. You can mix and match your protein and your vegetables, your carbohydrates, and end up with fairly simple cooking that still tastes very delicious and is nutritionally very good for you.
Yeah, I love this.
Yeah,
So, I know there's a lot of baking involved in this. So,
there
we're going to
is.
get started and you put me to work. I'm going to wash my hands first,
Okay.
safety first,
Yes.
and then tell me what you need me to do.
Okay. All right. So we already have prepared our salmon. We've cut it into portions that are about 2.5 ounces. The recipe we have calls for 3 ounce fillets. So these were pre-cut from the store. So we ended up cutting them in half. The beauty of doing that is your bake time is reduced. Um, and then we're going to prepare our asparagus and our potatoes. And then the potatoes will go in the oven first. We already have that preheating to 400 degrees to get started. And now that you've washed your hands, I'm going to wash my
Great.
hands real
Okay.
fast.
All right. This looks awesome. Yeah, I see asparagus, some red potatoes. I like that we have that pop of color there. Lemon, this colorful cooking at home. And like you said, I love that this has everything you need in one meal on one pan.
It really is fantastic. So red skin potatoes are some of my favorite. I
Hmm.
often buy the little mini bag of various colored potatoes. It just kind of makes
Yeah.
them more exciting to eat them.
Yeah.
They have a slightly different flavor than your white potatoes. So
Yeah.
um, just mix it up. Mix
Yeah.
it up. So I like to take my potatoes, and depending on what size they are, generally either cut them in half or quarters. Based on the size of these, I think I'm going to cut them into quarters, and then they'll cook just a little bit faster.
Okay.
So I'm going to
Sounds
start cutting
good.
those up.
All right.
And then kind of put them off to the side as we go. This doesn't take too long.
Yeah.
Very simple, not a lot of complicated knife skills required or anything like that.
Yeah. That's helpful too.
Yeah, so this is pretty simple. And these are pre-washed, but when you get them, you want to make sure they're rinsed and dry.
Mm-hmm.
This is easy peasy. And this is about 2 pounds of potatoes.
Okay. I like that we're keeping the skin on them as well,
Yes.
since that increases the fiber content of the potatoes pretty drastically, which is great. And of course, if your preference was sweet potatoes, that's an easy
It's
substitution
very
here.
easy. Yes, absolutely. I feel like I like the flavor of potatoes better when they have the skin on. They just
Yeah,
have
interesting.
a little more pizzazz.
Yeah.
Yeah. I know if I'm gonna eat a baked potato, I'm gonna eat the skin.
Yeah, absolutely. Potassium is another mineral that is increased when we're consuming the skin of the potato, which Greta and I know are is important
It is.
for heart health.
Absolutely.
Potassium is one of those minerals that can help counterbalance sodium in terms of blood pressure management. And there's truly not really any other food that has more natural potassium in it than a regular white baked potato with the skin on it. So sometimes we find if you're feeling like your potato has a little bit too much skin, cut it into a smaller bite, and that can really soften that skin when you're roasting it, if you're pan roasting it or sauteing them, and it might be a lot more tolerable even for a sweet potato. So I find that I am much more likely to eat the skin on a sweet potato if I just cut it into a smaller bite. which is
It does
great.
make it softer. That's
Yeah.
absolutely true. And I don't really know anybody that doesn't like potatoes, so that's exciting about all that potassium in them.
Yeah.
Universally loved food.
Potatoes are also really satiating. So that's a kind of a fancy nutrition word, but I was doing a little bit of research before this, and one of the things that they were sharing is that potatoes are truly one of the foods that seem to satisfy people most. That's what we mean when we say satiating. So, are you feeling satisfied after your meal? And sometimes when someone might be eating a healthier meal per se, they might feel like they're really hungry. So, let's not be afraid of the potato. It's going to make you feel good, keep you full longer, but there are obviously different ways that we can prepare it that make it more nutritious.
And I think potatoes get demonized as a carbohydrate.
Absolutely.
But they're really not that high in calories.
They're
either.
not.
No.
Yeah.
They're really, like you said, they're very satiating and can make you feel very satisfied. So I'm going to go ahead and transfer these over to our pan.
Okay.
And
Look
I
how
like,
lovely.
and we went ahead and put a piece of parchment paper on the pan. If you want to do that, you can. If not, it's not that hard to wash the pan when you're done either. This just makes cleanup a little bit easier. And I go ahead and I just throw everything on the pan and then I mix it up with my hands. So we're going to take our olive oil and we're going to use about 2 teaspoons. And I just go ahead and drizzle this over the top of the potatoes. A glug there. Okay. And then we're going to add our spices on top of that. And so we have our Italian herb seasoning blend. We're going to sprinkle that on there as well.
Beautiful. I can smell it from here.
Yes, I love Italian seasoning. It just has so much good stuff in it. And it's one of those spices that's easy, quick, and really gives you a good, powerful punch without being salt.
Absolutely.
Exciting. And then I'm also going to add a little bit of garlic powder on top of these two. You can use powder or fresh, whichever you like. And then I am going to finish up with a little bit of black pepper to taste. Perfect. And you can, add as much or as little as you like, depending on how much you like pepper.
Love it.
All right. Maybe we'll just go a little bit more. Okay. And then I'm just going to get my hands dirty. So I'm going to go in here and just start mixing everything up with my hands. And this gets everything nice and coated, gets that seasoning all over everything, gets your olive oil on there. And the idea is that olive oil is going to kind of help crisp your potatoes up a little bit in the oven, give them a nice flavor. You could use other oils too. I think you could use avocado oil if you prefer that. But I love olive oil for this. So you can kind of see how easy it is to get them really nice and coated with your hands. Or if you don't like doing that, then you could certainly toss everything in a bowl. Once I've got everything nice and coated, I kind of like to put the skin side down. You don't have to do this, but I feel like it kind of helps everything cook evenly. And then we're going to put the potatoes in by themselves for about 10 minutes. They take a little bit longer to cook than the salmon and the asparagus will. And so I feel like if we can kind of get them in the oven a little bit ahead of time for about 10 minutes, then we'll take them out and add everything else back to the pan, and then everything will kind of be finished cooking at the same time.
Perfect.
So I'm going to wash my hands again because
I will throw those
quite dirty, but yes, if you'll put them in the oven, we're going to stick them in for 10 minutes.
I'm going to show everybody what they look like too. First here, ta-da! So potatoes, check. All right. Timer.
I feel like the olive oil it's nice to moisturize your hands a little bit.
Exactly. Yeah. It's still winter, a little cool weather out there. Exactly. I do feel like that's one thing that we try and encourage a lot in our teaching kitchen space is just to get people touching their food again.
Yeah. Don't be afraid to touch it. You just wash your hands afterwards.
You wash your hands. Exactly. And there's something that just kind of connects you back to it. Sometimes it's really fun. I like shredding kale and just ripping it, depending on, can be therapeutic, even if cooking hasn't been something that's been a fun activity for you. Just start to be mindful, kind of bring it in. This is what we're doing right now.
we're so far removed from our food now.
Yeah.
Unfortunately.
Yeah.
I know for me, I haven't always been the best about cooking.
Mm-hmm.
I've gotten much better about that, trying to get healthier.
Awesome.
Definitely trying to practice what I preach to with my patients. So,
Yeah.
it is good to get in the kitchen, touch your food, and
Yeah.
just feel more connected to it.
I think then it makes it that much more satisfying when you take the meal out, you plate it, you sit down to eat it, and you're like, I did this. And it's
Exactly.
delicious.
Exactly. And you
Yeah.
realize it's not that hard.
That's
I
right.
think cooking can be really intimidating. I know it has been for me, but it's just like anything. The more you do it, the more comfortable you get with
Absolutely.
it. And
Yeah.
it takes practice.
Yep.
Nobody is necessarily born knowing how to cook perfectly.
Exactly. Exactly. Yeah. So even you already taught me something. I never really thought about flipping all the potatoes so that they're skin side down, but that makes so much sense. So
And it's just something I started doing because I was like, I think this kind of makes the skin nice and crispy.
yeah,
And then
absolutely.
when we take them, we'll kind of flip them all around and let other sides touch the pan.
Yeah.
Get that crispy too.
Makes so much sense. Never thought about it.
Okay.
Love it.
All right.
Great.
So we're going to go ahead and while that's cooking, we're going to prepare our asparagus. And our lovely chef Caroline shared a tip with me today that when you, I've always cut my asparagus, but then every once in a while I'll hit kind of a woody end and be
Yeah.
pretty bummed about that. But she said if you break the asparagus, it will show you where it needs to be cut.
Look at that.
Oh, so that I
All
learned
right.
something new
I'm
today.
gonna
Yeah.
dig in and
Yeah. We'll just
help
break
you
this
with
up.
some of these. This is fun. All right, here we
So
go.
again, we're just
Look at that.
I know. And I'm kind of with you about touching the food with like broccoli,
Okay.
you don't have to cook or cut up your broccoli, the whole head of broccoli. Just
Yeah.
start ripping pieces off. That's
Yeah.
fine.
Anyone that has children or grandkids, that's another trick that I've been showing them is that you don't need a knife. That's a great
Exactly.
way to involve some of those little ones in there.
Mm-hmm.
And they have a lot of fun
Yeah,
tearing up some little trees.
that's right. Little green trees.
Look at that.
Yeah. So
I will actually sometimes save the asparagus
Uh-huh.
ends and put that in my vegetable broth bag.
Okay, nice.
Yeah.
Nothing goes to waste.
Nothing goes to waste. Exactly.
Yeah.
Because
So-
we don't necessarily want to eat those because they can be very tough and woody,
Yeah,
but
very fibrous. Yeah.
Whoop.
So that
All
was
right.
really, really fast. That was a pound of asparagus, like done.
Yeah.
Easy peasy. So that is ready. I'll just stick that back in our bowl for when we're ready for it. And then I'm going to go ahead and start slicing our lemon up too, because this is going to go on top of the asparagus as well as the salmon.
Okay.
So I'm just going to slice
Perfect.
the end off here.
I'm going to, do we need this bowl again? I think or no?
I don't think we do.
All right.
I think
I'm
we're
gonna
probably done with that.
grab our asparagus ends out of the
Good
way
plan.
here. All right. So you're just slicing the lemon into nice circles.
I am.
All right.
And then when we put the asparagus and the salmon in the oven, we'll add that lemon on top, and it's going to give it lots of nice, bright flavor.
Oh, I can
love
smell that.
love using citrus in the
Mhm.
kitchen in place of salt. It does help brighten the flavor, kind
Yeah.
of give it more of a punch.
Yeah.
While not adding any sodium, so it keeps your recipes nice and heart healthy.
Absolutely. You're doing such a beautiful job cutting that. I feel like one of the things I actually had a patient teach me a while ago was they will get a lemon, a lime, an orange at the store, and you have these good intentions for making infused waters and things
Mhm.
like that. But then we forget about them.
Mhm.
They live a little too long in the back of the crisper drawer. We've all been there, and you go, "Oh my gosh," and you don't think about what you were going to do with it or that kind
Yeah.
of stuff. But so they taught me they come home, they wash all of them, they cut it into slices, and then line a Ziploc bag, a freezer bag, with the slices, and then toss it in the freezer.
Oh,
So now
that's
you've already cut
genius.
it. And then if you want to use it for your water or your tea, it's already in a slice. It's almost like an ice cube because now it's frozen. Or I'm standing here right now thinking if you wanted to add it to your lemon, or I'm sorry, your
Yeah.
salmon or your asparagus, then you can just pick out a couple of those pieces and thaw them. And now we're not
Absolutely.
wasting it either.
Yeah, that's brilliant. I love
Yeah.
it. That's really, really
So
smart.
I do that a lot more now. And then it's kind of always on hand too. So that's the other
Very
thing is
smart.
this got all this stuff, but I forgot my lemon or I forgot. And no, it's okay if we forget our lemon for this recipe, but it will enhance it
Absolutely.
if we have it.
Mhm. And then I'm going to now go ahead and make our sauce for our salmon. It's going to be a honey mustard kind of herb butter that we're putting on
Yum.
top. I think it's going to be really yummy. So I'm going to just pop our butter into the microwave for about 20, 30 seconds,
Okay.
kind of heating it slowly till it gets melted.
Okay.
All right.
So we are using salmon today, which is a great source of omega-3 fatty acids. And a lot of us in the United States are not getting enough of those omega-3s. So those are the heart healthy fats. And so we want to increase our ratio of omega-3s to these omega-6s. Both of them are considered healthy unsaturated fats versus saturated fat, but salmon is a great way to get it in. And the thing about the omega-3 fatty acids is that our body can't really produce them, so we have to be eating them in order to have enough of them in our system. So I love the idea of using a honey and a mustard. If you're not a big fish person, I can really see how this plus the lemon plus some of the pepper can flavor it and take away some of that fishy taste. And then you've got it all cooking with your asparagus and your potatoes together. So again, kind of making it part of the whole instead of this big old piece of fish that seems intimidating or unappetizing sometimes.
I personally absolutely love salmon,
Mhm.
and just through some experimentation over the years, I find I really do prefer a fresh piece of salmon, something that's never been frozen.
Okay.
Just has a much better flavor to it.
Sure.
It's not really that much different for cooking because even if it were frozen, you would need to thaw it out.
Yeah.
But I
Yeah.
think it has, especially if you're buying it very fresh, it should not have a super fishy flavor to
Right.
it.
Yeah.
And it just, to me, it's more buttery and
Mhm.
soft and just a much more pleasant,
Mhm.
enjoyable
Yeah.
thing to eat than if it
Yeah.
were frozen first.
Absolutely. Yeah.
Yeah. And then,
Sometimes that is it. It's just experimentation. It's like, okay, I know this food is nutritionally great for me. It's not my favorite, but trying it at least 2 or 3 different ways before you really write it off.
absolutely. Absolutely. So I've got our melted butter here.
Great.
It only took about 20 seconds to get in
Okay.
there. It's not very long. And I'm going to go ahead and start mixing in our other ingredients with that. So I've got 2 tablespoons of unsalted butter,
Okay.
and then I've got let me see, 2 tablespoons of honey that I'm going to add to that. That's going to give our salmon a little sweetness.
Yum. And yeah, we would consider honey an added sugar, but again, this is what's going to almost caramelize over top of this fish. It's going to help reduce the fishy flavors. So we're really using that little bit of added sugar, which is going to be divided by 4 servings to go a long way and enhance that flavor. So we're letting all those things work together instead of, having a cookie or some of these other things on the side,
Exactly.
which makes a difference in terms of added
All
sugar.
right. And so I did add also a teaspoon of Dijon mustard.
Dijon, like that.
I love Dijon mustard. It
Yeah.
just has such a nice little kick of
Yeah.
flavor. And I think all of this is almost going to give it kind of an Asian kind of feel to this butter mixture.
Even that's really adaptable. So if
It
all you
is,
had was
absolutely.
yellow mustard, that's fine. It'll taste great. Mustard is a binding agent, interestingly. So we've got our oil. In this case, there's butter, there's oil, there's fat in there. And then we've got our honey, which does have some water in it. And so the mustard is really what helps combine those two things together and turn it into more of a cohesive sauce. So if you see mustard in some dressing recipes, a lot of times that's why it's serving an actual chemical purpose too, not just a flavoring purpose.
All right. And then finally to the sauce, I'm going to add half a teaspoon of Italian herb seasoning.
Yeah.
So we're going to carry that flavor from our potatoes
Right.
on into our salmon as well.
Speaking of potatoes.
Awesome. They're ready. It's been 10 minutes.
All right. Should I flip them or?
Yes, if you will grab them out of the oven, we'll go ahead and flip them, and then we'll put everything else on the pan with them.
Okay. Oh, I can smell them. Yum.
And while she's doing that, I'm just whipping up the sauce to get everything incorporated.
All right.
Oh, they look beautiful.
They
So we're
do.
just going to agitate those around, flip them around so that
Okay.
different sides end up on the pan.
And should I put them kind of
Yes.
to the side like
Yeah.
this?
So since they've had a chance to kind of be separated and cook up until this point, it's okay to kind of shove everything to one side to make room for our salmon and our asparagus now.
All right.
And this is how we're going to keep everything on one pan. They look beautiful.
They do, and they smell awesome.
Yeah. So we're going to go ahead and that looks great. We're going to go ahead and now add our asparagus onto the pan. And I'm going to add a little bit more olive oil onto that asparagus. Kind of what we did. Be careful with this since your pan is warm now.
Do you need the
coming out of the oven? I probably will.
Okay.
Thank you.
Safety first.
That's
in the
right.
Kitchen.
No burning yourself.
Nope.
No burning allowed.
It's Friday. None of that allowed.
Yeah. And so we're going to, again, we're just tossing this in olive oil, getting it nice and coated. That'll help the salmon kind of crisp up a little bit. And I'm really trying not to touch the pan, keeping myself safe from that, but it's really pretty easy to do that. And then I'm going to add pepper over this to taste. We're going to add some seasoning to our asparagus.
Yum.
Mix that up a little bit more, kind of just like what we did with our potatoes. We're just touching our food and getting it mixed.
Yep. You're right. I think that's such an important point in roasting too, is just really making sure that we have every surface of these vegetables coated, because when there is a little bit of oil that's missing, it does create just that bit of uneven cooking. And then you're missing that little bit of flavor that we want out of this too. So
absolutely. So I'm going to go ahead and add our salmon onto the pan now.
Okay.
Just kind of staggered on there. You want to give it a little bit of space in between each of the fillets so they all get good air to them.
Out of curiosity, I'm just going to dip my finger in here and taste this. That's delicious.
It is. It really
delicious. Ooh, I'm excited. Okay, not that I wasn't excited before because I knew it was going to be good, but oh man, yum.
So we've got everything on our one pan now, which is really exciting. I'm going to go ahead and grab that delicious sauce, and I'm just going to start brushing it on top of the salmon.
Okay.
This is super easy. I think if you didn't have a brush at home, you could certainly just pour it on and that would be okay.
Yeah. Oh, beautiful.
It does. It looks really, really good.
Yeah. Can't wait to show everyone that too.
I think the salmon is going to be delicious. Cannot wait. All right. And then we're going to go ahead and cook this for another about 15 minutes. We want to make sure our salmon's done, but not overcooked. Caroline and I were talking about how we really don't like overdone salmon because it just makes it kind of dry and sad. I think a lot of times we're kind of afraid of undercooking our meats, but at the same time, you don't want to overcook it because it's not as palatable, as enjoyable.
Yeah, absolutely.
All right, so got our sauce on there, and now we're going to take those lemon slices and lay them on top of our asparagus. Ooh. Look how pretty that is.
Lemon pepper asparagus, yum.
Yes, and lay that out there, and then we're going to lay lemons on top of the salmon as well.
Oh, beautiful.
Yeah, that's so pretty. So you're getting all this nice citrus juice, but then also that lemon oil from the peel is great too.
Absolutely.
Oh, that turned out so pretty. There we go.
Look at that.
Ready to go back in the oven now.
And I'm sorry, you said 15 minutes?
Yes, 15 minutes.
Look at that, everybody.
Gorgeous.
It's so gorgeous.
Yeah.
Chef Caroline likes pretty food, so that's what we're doing.
Pretty. Right, thank you, Carrie. I'm going to wash my hands again so they're covered in olive oil.
All right. Okay, 15 more minutes back in the oven there. And this is kind of nice. So I see you have even a little bit of the dressing mixture left. So that could if you did not put it on the raw salmon like that, if you
Correct.
just wanted
Yeah.
to spoon it across, or something like that,
Mhm.
and you left it by itself, then you could use that remaining dressing on the top of your,
Yeah, you just want to make sure you do not contaminate yourself with raw seafood.
correct. Yeah. So if you
Food
did dip
safety.
your spoon or your brush into this, we do want to discard it or cook something else with it. But if you did not, then that would be extra that you could drizzle across your plate at the end too, if you wanted.
Yeah.
So we've got these 15 minutes or so, and I would love to hear more about what you guys do at the heart failure clinic. Where are you? How does someone find you? How does somebody need you guys? Um, how does somebody avoid needing you guys?
So the heart failure clinic is kind of a little hidden gem. A lot
Yeah.
of people don't know about us, but we actually have a really large presence within Spartanburg Regional now. We have a heart failure clinic at all 5 of the hospital campuses, which allows us to be where people are.
Yeah.
We have patients all over the upstate now. We have patients as far away as Enoree, up in Landrum,
Wow.
sometimes up in Shelby, in
Mm-hmm.
North Carolina. We have patients all over. So to qualify for the heart failure clinic, a person has to have a heart failure diagnosis. We do not
Okay.
diagnose, we just treat, and then they need a referral from a healthcare provider. Um, Typically, our average patient is referred to us from the hospital, typically after a heart failure exacerbation that results in them needing to be in the hospital or going to the ER. A lot of our patients are fluid overloaded, and they have those classic heart failure symptoms of swelling, shortness of breath. They're seeing rapid weight gain on the scale from all that fluid. They may get to the point where they're really struggling to sleep at home because when they lay flat, they feel like they're being smothered. A lot of people have ended up in their recliner. I hear that one a lot. And they just don't feel good. And it gets to the point where they're really, really in distress. And that's what takes them to the hospital. So they'll get referred to us. And our goal is to help control their heart failure symptoms by making sure that they're not holding on to too much fluid, that they get on all the right medicines to help treat their heart failure. We prescribe guideline-directed medical therapy that is recommended by the American Heart Association and the American College of Cardiologists. We go by the guidelines and we make sure that everything we're doing is evidence-based. All the studies are there to show that these medications in particular really do help strengthen the heart again, as well as reduce those symptoms and help our goal is to keep people out of the hospital.
Yeah.
That is our number one goal. We don't want them to have to go to the hospital. It's not fun to be a patient in the hospital. So if we can keep them well and keep them at home and increase the length of their life, that is what we want to do.
Amazing. You guys do such good work. So tell everyone about the community paramedicine program too.
So this is a really awesome program that is unique to the heart failure clinic. It's the first of its kind within Spartanburg Regional Health System. So our community paramedics essentially take the heart failure clinic to a patient's home.
So cool.
So cool. And these are patients that would struggle to get into the clinic. Maybe they lack transportation or they rely on a caregiver to bring them to their appointments who has to take off a whole day of work to take them to appointments. Maybe they struggle with mobility issues. They're in a wheelchair or they've had an amputation and maybe they don't have a prosthesis yet. We also have a lot of folks who just are so short of breath, but because of their symptoms, it's really a struggle for them to get out to appointments. Other folks really, maybe they're able to physically get into the clinic, but they're just not being super successful at staying out of the hospital. There are even a lot of readmissions. And if we're able to go in their home, we're able to kind of do a little sleuthing and see what is their home situation, because what people tell us in the clinic may not actually be their reality at home. They may have challenges that we don't know about that make it a lot more difficult for them to be successful at managing their heart failure. We're all about meeting them where they're at. And so if that means going to their home, it works great. And it's been so successful. for those patients who've been enrolled in our paramedicine program for at least 12 months, we've taken the data and we've compared that to the previous 12 months. We've had an over 90% reduction in hospitalization and ER visits for those patients. So this program is really successful. There's something to be said about meeting people where they are.
Yes, absolutely.
It really is. And so we are actually, just this past Monday, we hired our third community paramedic. We now have one for each of the 3 counties we serve in the upstate. So we're in Spartanburg, Union, and Cherokee counties.
Amazing.
And at some point, we'll probably need to hire a second paramedic for Spartanburg County because it's so large. But there's really a demand. Heart failure is actually the #1 readmitting diagnosis for hospitalized patients. So the numbers are growing. The number of people with heart failure in America is growing. The population in the upstate is growing as well. So we just know that we have this continued need here for heart failure patients. And this program has done such a wonderful job at helping those people. We had, I think our first community paramedicine program was out in Union, and really, really wonderful patient. And he was actually a patient at the heart failure clinic for at least 3 years, but he got good 3 years, but he passed away in his sleep not that long ago, but he got a very good 3 years.
Yeah. Well, first of all, thank you guys for everything you're doing, because we know that heart failure is a lot to manage. And so again, reach out to these folks, getting a physician referral to get to them if you are someone with heart failure and you are not. Yes, we know it seems like one extra place to go, but these folks are dedicated to just supporting your heart failure journey. And so that is, having those extra sets of hands, as you heard, is crucial to this, because there is a lot to think about when it comes to in terms of medication and how you're sleeping and how you're moving and what you have access to. So these are your people in all of our service areas, which is incredible. Let's switch gears a little bit and talk about how we prevent heart failure, or how we prevent getting that exacerbation occurrence if you are an active heart failure patient.
Sure. So the #1 risk, or the #1 risk factor for heart failure, is actually coronary artery disease. So if we can do all the things to help prevent you from getting coronary artery disease, that could potentially keep you from going into heart failure. It's those chronic blockages in the coronary arteries that over time can lead to a failure of that heart muscle. It starts to become weakened and damaged. Or if someone has an acute event like an MI, a heart attack, they can suffer a lot of damage in that area where the blockage is. So if we can do things ahead of time to prevent coronary artery disease, that's going to go a long way to preventing heart failure. And unfortunately, having a heart attack makes you more at risk to have another heart attack down the road. So we see a lot of folks after they've had their first heart attack, and it's all about what can we do to prevent that from happening again. Yeah. And so we talk about things like lifestyle changes, make sure we're getting good aerobic exercise, that we're managing blood pressure, because that also causes hardening of those arteries, that we're managing cholesterol through diet, maybe medication if needed, that they're taking all their medications that have been prescribed for them after their heart attack. It's also interconnected, so we make sure that they have a good understanding of that treatment as well.
Absolutely.
And we do not take the place of our patients' cardiologists. We are actually meant to be a temporary clinic for them. Our goal is really to get them in, get them stabilized, get their symptoms managed, work in connection with their cardiologist and primary care doctor. And then if they're doing a really good job of managing their symptoms at home, they seem to have a good handle on how to eat, low sodium, and they're also limiting their fluids, and they're not having heart failure hospitalizations. Our goal is to graduate them from our program.
We like that.
Yeah.
We like graduating.
Yeah. So like you said, it is one more place to go. And I think a lot of people are hesitant to add any more visits in, but it's not like cardiac rehab. You don't have to go 3 times a week for 12 weeks. We get people in, and just like any other doctor's office, how often you come in based upon how you're doing, how are your symptoms, how often are we having to change your medicine. So it's very patient specific.
And I think it's so nice because with the heart failure and the fluid changes, I mean, that can happen as rapidly as overnight.
Absolutely.
And these people are looking out for you. So
Absolutely.
there's all sorts of really neat remote monitoring systems that they have now. So these devices can talk back and forth to the clinic themselves, which is really cool. And you've got somebody that's got your back there that's like, you know what? If you forgot to step on the scale or if you forgot to check your blood pressure, we're looking out for you. You know, go ahead and make sure we've got that number in today, or that's a really high jump on that scale today. Someone's there to just be that extra set of eyes.
We do a lot of education with our patients. We are so fortunate. Our first appointment with each patient is scheduled for an hour.
Amazing.
You don't get that anywhere else.
Yeah.
You might get your 15 minutes and then you have to go. But we take a lot of time with our patients because we want them to understand what is going on with their heart
Yeah.
and what can we do to actually help control their heart failure.
Yep.
We teach them a lot about the signs and symptoms. And if those symptoms are getting worse, if they are new or changing, please call us immediately. Do not wait at home to see if it gets better. Go ahead, be proactive, call us. That's what we're here for. It's why we exist. Again, our goal is to keep them out of the hospital. And like you said, heart failure patients can kind of hang out and they are compensating, as we say, until they're not. It's like they're just okay, and then they like fall off a cliff and they're just so sick and become very, very desperate, very short of breath. So if we can get them where they're not doing that frequently, where they're really, really stable, that's our goal.
Yeah. Great.
Yeah.
Great. So we're in the kitchen for a reason because nutrition plays a big role in especially fluid retention and blood pressure management and development of that coronary artery disease, which is a leading factor of heart failure causes. So we made salmon. We talked a little bit about that. Asparagus, I'm going to check my notes here real quick because asparagus are really fascinating. There's a lot of great compounds in asparagus. 94 different phytochemicals, phyto meaning plant, chemicals meaning active substances in an asparagus. So these chemicals are interacting with our bodies in a positive way, and that can lead from everything to helping to manage our cholesterol, which is really interesting. So there are some of these polyphenols, they're called, which is interesting. Those are also found in olive oil, which is why we have a very specific olive oil here that has a high polyphenol count. We have a great option here in our area where they are importing olive oils, but they have the polyphenol count next to it. So now you might know that's what that word is. Those are the blood pressure lowering, heart healthy, gut friendly antioxidants that we want. So the higher polyphenol count you can tolerate, the more benefit you'll get from it. And the reason I say that, it's because polyphenols are an alcoholic compound, chemically speaking. So if you were to take just a little taste of this olive oil right here, and even smelling it, sometimes you can just smell that there is almost this alcoholic smelling scent to it. And so if you tasted it just by itself, you might get a little burn on the back of your throat. That is the polyphenol talking to you. That's a good thing. So, but it might not be everyone's favorite flavor. So again, we're just taking a little bit in this case. We're putting it on our potatoes, but we can also get it from asparagus, which is super cool. So 94 different compounds. We've got some of the heart health effects going on that way. Very interesting anti-tumor functions within some of those as well, particularly for colon cancer, breast cancer, and pancreatic cancers as well. So there's a lot of good benefit that asparagus have in the immune function, which is some of the cancer, the beginning stages of cancer as well in that way. Good source of selenium, which is one of the minerals that is an antioxidant and good for brain function. So we like that about it too. We all want to keep our wits about us for as long as we can. And let's see. Garlic. We use a lot of garlic. So even just 1/4 of a teaspoon of garlic powder every day has been clinically shown to lower blood pressure. So that's not that much. That's pretty doable. And that is our timer. Let's see how we're doing. All right. I am excited.
Looking beautiful.
Oh, look how beautiful.
That looks great. I think we're good.
Yeah. I am going to grab I might just stick it back in for a minute while I grab a fork so we can see what the potatoes look like.
Sounds good.
That's usually my go-to. Chef Caroline might have a different option for us, but usually just like to fork a potato and see, is it still a little bit too hard or is it going right through it and coming off?
And I usually just eyeball them.
And Greta's an eyeballer, so
I know when they kind of look right.
yeah. Okay. Did these look right? Did they meet the eyeball test?
Let's try the fork. Let's try the fork.
All right, let's see. So I'm just gonna take a pretty maybe
a couple more minutes.
Maybe a couple more minutes. Maybe what we'll do is kind of
As I said,
fluff
we
the
can-
asparagus around too, and
And
then
if we needed to pull off our salmon
Yeah.
for a little bit, so that it doesn't get overdone, we could go ahead and do that.
Yeah.
too.
and actually, so while you do that, I'm going to clear off our station here. Spent so much time talking about heart failure clinic that I didn't clean up, but it's good stuff. All right. And that way we'll be able to show everyone.
I'm going to go ahead and grab
And a
a plate
second
so that
plate.
we do not
Good.
put raw salmon on our
Correct.
salmon.
Like that. All right. I'm going to move this over. And then, okay, so you think our salmon looks good? Yeah,
think
this is
so.
sometimes
Yeah.
what I like to do is just test that with a fork as well. So yeah, you can see that this is just forking
It's nice and flaky.
right apart. I mean, it didn't need anything, but it's still very moist and our beautiful lemon to coat right there. So I did mess this one up, so that can be mine. How about that? But that is one of the easiest ways to tell whether or not it's been done. So do that. The asparagus are getting this beautiful green color.
They
which is
do end up
amazing.
just kind of, they get a little brighter green than
They
they
do,
were
yeah.
prior to going into
Look,
the oven.
beautiful.
And
So
they
I
smell so
feel
good
like-
too. You can kind of see.
Oh, the asparagus seem like they're done too, but it's okay to cook them for a little bit longer. They can start to get a little more brown.
Yeah.
We're by piling them up like that, we're almost using a combination of steaming and roasting. So we can spread them out, get them in a little bit of sauce, maybe throw the potatoes in for a couple more minutes. Chef Caroline, do we have any questions from anyone? All right. So think about any questions you might have for Greta or myself about either the recipe or our heart failure programs.
Lay our lemons back on top of there so we continue. to
All
get
right,
that
we're putting the
flavor.
lemons back on so that we
Yes.
can optimize flavor here.
There we
I
go.
like it.
All
Okay.
right. Can put that back
Put
in.
this right here. All right. So we'll just give it maybe, I don't know, 5 more minutes.
That sounds perfect.
If that, let me see how we're doing on time. Excellent. And so the nice thing, you'd think I'd know how to work the timer at this point in this kitchen, but not my home kitchen. So Greta and I have had plenty of time to gab about all things heart, which is great. But during that time at home, I would totally be meal prepping some other things.
Heck yeah.
Because that to me is one of the easiest ways to eat a heart healthy diet is to cook once or really dirty up my kitchen once, limit my pots, pans, all sorts of things, and then be good for a little bit. So that's the perfect time. You're cooking dinner. You can easily be making some breakfast items for the
I did
morning.
exactly that the other day. So this week I actually ended up making a sheet pan dinner, but I did chicken, potatoes, and roasted broccoli, which
Okay.
ends up a little crispy and brown. It's
Yum.
delicious. And it was like, well, while that's baking, let me go ahead and mix up my breakfast frittata.
Awesome.
So I use eggs, a little bit of cottage cheese actually,
Okay.
and then spinach and tomatoes, a little bit of mozzarella on top, and that's
Yeah.
breakfast for the whole week. And then as soon as the sheet pan dinner came out the oven, I threw my frittata in, and I was ready to go ahead and eat my dinner while my
Perfect.
breakfast cooked. So I'm totally
Yeah.
with you. If you can just dirty your kitchen once,
Yeah. And in that case, you're even preheating your oven once, because I know that sounds
Exactly.
kind of silly, but Preheating an oven takes a while. So
It
if we're going to
does.
do it,
Exactly.
are there multiple things that we can even do in the oven for this week? I love that.
Yeah.
That's great. This is Colorful Cooking at Home, and we like to talk about plant foods, count plant foods. So just in looking through this, we've got our red potatoes. I'm going to count those as red. We've got our yellow lemon, green asparagus, and then we've got our white garlic, and all of these herbs that are within our Italian seasoning. So most of your Italian seasoning blends are going to include a combination of oregano, basil, rosemary, thyme, parsley. And don't forget that those are leafy greens too. We just don't always eat them in the same quantity that we would think of as kale or broccoli or those leafy greens, but they are doing some of the same things, being nitric oxide release or production, which is really important for heart health. So we have these really, really skinny cell layers that are on the outside of our, or I guess I should say on the inside of our vessels. And they are that first line of defense. They produce something called nitric oxide. That's the endothelial wall there. It produces nitric oxide, which is a vasodilator. It opens up our blood vessels. So if our blood vessels are able to be open, dilated, and relaxed, that means there's less pressure, because when they're tight and there's just more blood flow, or the same amount of blood flow that has to get through a smaller space, creating more pressure. And so we can open them up, we can relax them. And our body is designed naturally to produce nitric oxide. And the only way those cells do that is by reducing inflammation. All of these foods are very anti-inflammatory, but we can also eat sources of nitric oxide, which is great. And those are mostly going to be your leafy greens. So basil is one of the herbs that produces some of the most nitric oxide. So by even eating it dried, we're getting some of that within this blend here. So we also, where did we get this recipe from, Greta?
So we actually, this has been more than a year in the making, decided that the heart failure clinic needed a new cookbook to give to our patients. So previously we had a cookbook that was very lengthy and very complicated recipes. And I had a lot of feedback from our patients that they just felt like it wasn't something that they were going to cook or that they feel comfortable doing. And so I thought, you know what, we need to make something ourselves that is specific to our patient population. And so Alexandra over at the Heart Wellness Center and I, she's another dietitian, she and I worked together to develop a cookbook specifically for our heart failure patients. So all of the recipes are low sodium, and they're actually good. The idea is that just because something doesn't have sodium doesn't mean it has to be bland. It should still taste good, and it should be things that you want to eat. So we have all kinds of stuff in there, like pancakes and cornbread. We've got collard greens, pot roast, chicken noodle soup, all kinds of delicious recipes that we hope people will actually enjoy making and eating. So that's been a labor of love, and we're really excited to have that for our patients now.
This looks perfect.
It does. It's beautiful.
Here we are. I'm going to let you plate some of those up.
All right.
And one of the ways that we have been excited to partner in culinary medicine with cardiology is through a in-person cooking class, a Cooking Up Confidence series. So we have been using this cookbook now to also teach patients that are our heart patients. Not only, again, yes, we're saying this, yes, we're providing the recipe book, but let's get in here together. Let's learn together. Let's taste it together. Let's troubleshoot together if we find that something didn't quite work right, or maybe someone's potatoes were cut too big and they're slightly different time than this or that, because we understand that cooking is a labor of love as well, but it's just one of the best ways that you can take care of your heart, and we're all in this together. So we really enjoyed having you guys and your patients in
We love
the
it.
teaching kitchen and are looking forward to more of that to come. So
I know I get that feedback from our patients a lot that they are very intimidated by
Mhm.
cooking, and I'm right there with them. It can be
Yeah.
a bit overwhelming, but at the same time, again, the more you do it, the more comfortable you will feel.
Absolutely. Yeah.
And I've realized too, after talking to our patients, there are a lot of patients they've never cooked. They're so used
Sure.
to eating packaged and processed food, and
Yeah.
you're all of a sudden saying you really need to cook at home. You
Mhm.
can't eat out 3
Yeah.
times a day, or you
Yep.
can't eat, Stouffer's lasagna
Right.
every evening
Right.
and really be successful at
Right.
managing your heart failure.
Yeah.
So the feedback that they've given has also been really helpful in talking about, it's okay to be scared, but let's go ahead and work through that and just experiment in the kitchen. I tell them, if you try a brand
Yeah.
of something and you don't like it, try a different brand.
Exactly.
There's no harm, no foul. Just
Exactly.
experiment in the kitchen and you hopefully will get more comfortable with it.
Absolutely. When we've got foods at our disposal with 94 different compounds that can help manage blood pressure, manage cholesterol, manage cancer reduction, we want to get them in.
Yeah.
And maybe this is going to be my new favorite way. I'm digging in.
Okay.
All right.
That's good.
Cheers. That's a hot potato, but a good one. Mm.
Oh, that salmon is so good.
Mm-hmm.
It's sweet, it's tangy,
Mm.
it's flavorful,
Mhm.
really tender and soft. It's delicious. And it's not overcooked.
It's almost like a little pillow.
It is. It's absolutely
Who knew
yummy.
that salmon could be pillowy?
Mm-hmm.
Delightful. Any questions? Greta, you made this look so easy. You really did. And this is another reason to just invite your friends into the kitchen so that you can chat, you can cook together. We can all help each other become the healthiest, best versions of ourselves. But if something happens, we're here for you. The Heart Failure
Mhm.
Clinic is here for you. So thank you so much for your time. I'm looking forward to this meal. And I think with that being said, it doesn't look like I said, you made it look so easy. So we
It really
appreciate it.
is easy. That is not a complicated meal to make, and it's
Yeah.
delicious.
Happy American Heart Month, everybody. We are going to see you next month with 2 because it is National Nutrition Month. So we are looking forward to having the VCOM med students coming in. We've got some that are very interested in the connection between nutrition and skin health.
Beautiful.
So we are going to use some recipes that are very healthy for our skin. And then we've got our oncology dietitian, Livy Trapp. She is going to come later in the month of March, and she will be doing a Mediterranean bean salad, and we'll be talking a little oncology nutrition as well. So we're excited for that. You can find those events on spartanburgregional.com/events under food and nutrition. So see you at some of our events next month. Thank you.